A new study suggests that high butter consumption may be linked to a shorter lifespan, reinforcing the long-standing debate over the role of dietary fats in health and longevity. While butter has long been a staple in many diets, its saturated fat content may contribute to an increased risk of heart disease, cancer, and early death. On the other hand, replacing butter with plant-based oils like olive, canola, and soybean oil appears to lower these risks and promote longer life. The study followed over 221,000 middle-aged adults with no prior major health conditions for more than 3 decades. Participants regularly reported their dietary habits, including butter and plant oil consumption. Over the course of the study, more than 50,000 deaths occurred, including from heart disease and cancer. The findings were clear. Those who consumed the most butter had a 15% higher risk of premature death compared to those who ate the least. In contrast, those who primarily used plant-based oils had a 16% lower risk of early death, highlighting the significant impact of dietary choices on longevity. The difference in health effects between butter and plant oils comes down to the type of fat they contain. Butter is high in saturated fat, which raises LDL, bad cholesterol, and increases the risk of heart disease. In contrast, plant-based oils are rich in unsaturated fats, which improve cholesterol levels and reduce inflammation. Previous research has shown that replacing saturated fats with unsaturated fats lowers the risk of cardiovascular disease, supporting the results of this new study. One surprising aspect of the research was that even a relatively small amount of butter appeared to increase health risks. Participants who consumed about 1 tablespoon of butter daily had a significantly higher likelihood of premature death compared to those who consumed almost none. Interestingly, the negative effects of butter were mostly tied to how it was used, spread on bread, for example, rather than in cooking. In contrast, consuming an additional 2 teaspoons of plant-based oils daily was associated with an 11% lower risk of dying from cancer and a 6% lower risk of heart disease-related deaths. Among plant oils, canola, soybean, and olive oil provided the greatest longevity benefits. However, corn and safflower oils did not appear to have the same impact, suggesting that not all plant-based oils offer equal health advantages. While the study did not establish direct causation, the strong correlation between butter consumption and higher mortality risk adds to the growing body of evidence supporting plant-based fats over animal-derived saturated fats. Despite the compelling results, the study has some limitations. It relied on self-reported dietary intake, which can be prone to inaccuracies. Additionally, most participants were white healthcare professionals, which may limit how broadly the findings apply to other populations. It is also possible that people who consumed more plant-based oils had overall healthier diets and lifestyles, contributing to their lower risk of early death. Nevertheless, experts agree that shifting dietary fat sources from butter to plant-based oils is a step in the right direction for longevity and overall health. Using olive or canola oil in salad dressings, roasting vegetables, or sautéing lean proteins can maximize health benefits. However, moderation is still important. Even healthier plant oils are calorie-dense, and excessive consumption could lead to weight gain, which carries its own health risks. Ultimately, this study serves as a reminder that small dietary changes can have a significant impact on long-term health. While butter may add richness to food, relying on plant-based oils instead may contribute to a longer, healthier life.